Welcome to ABMK2's Behavioral Health, a consultation with Counseling Consultants, Inc. I am Aubrey.
I am Becca.
I am Katie.
I'm Melissa.
And I'm Kelsey, and we'll be your presenters.
ABMK2 Behavioral Health came to Counseling Consultants, Inc. to identify and resolve issues that are affecting the overall function of the workplace. The consultees are Dr. Angela Decker, who is the CEO, 3 clinical supervisors, Talia, Katerina, and Josephine. The organization had issued surveys to employees, and surveys resulted in low productivity, high turnover, and low morale were indicated. The surveys also indicated that these issues were due to lack of resources, communication, and managing conflicts. The Dr. Angela Decker discussed with the consultants that the reason for low productivity, high turnover, and low morale were based on technological usage. There was a lot of cell phone usage, social media being used, YouTube, and watching videos, Facebook, Twitter, and that was really getting into the productivity time. Then we have government funding. The lack of funding, the government just isn't giving them money. As for high turnover and really a lack of morale, they are unsure of what is going on.
At this time, please visit the YouTube link provided on Blackboard to watch the interview video. Thank you.
To assist ABMK2 Behavioral Health with finding possible solutions for areas presenting deficits within the organization, the consulting company, which is Counseling Consultants Incorporated, will provide mental health consultation using the Kaplan model. The Kaplan model was developed in the 1960s, and it was developed by Gerald Kaplan. ABMK2 Behavioral Health is headed by Dr. Angela Decker, who discussed that the present culture within the organization is impacting the services provided to clientele. Upon the firm's strong recommendation, secondary consultees will involve the 3 primary supervisors who head programs under Dr. Decker. Using a program-centered administrative consultation, Counseling Consultants Incorporated will be able to identify issues that are impacting the culture and functioning within this organization. As a result of seeking consultation, an action plan to address and identify issues will be devised. Working with the leaders of the organization, the primary focus will be to improve communication among leaders, increase employee productivity, and develop a plan for training to improve leadership skills of the organization. To complete the consulting experience, the following implementation is recommended, and a following meeting will be arranged to evaluate the effectiveness of implemented recommendations.
For the assessment and diagnosis purposes of the consultation, taken into account was the internal survey that ABMK2 had already conducted. However, to provide evidence-based approach to their consulting efforts, they advised the use of the managerial behavior survey. This survey was to provide information to either refute or support the organization's suspected issues. It has been proven to both be a reliable and a valid instrument. Some of the measures that were listed among the behaviors assessed were planning and organizing, clarifying roles and objectives, monitoring operations and environment, problem solving, networking, informing, consulting and delegating, motivation, supporting and mentoring relationships, recognizing and rewarding programs. However, the results that were indicated from ABMK2's results were lack of motivation, supporting and mentoring relationships, managing conflict and team building, and recognition and reward were indicated as areas needed for vast improvement. This leads us to believe this could be the source for the low productivity, high turnover rates, and low morale that ABMK2 has been experiencing. With these results and diagnosis within the company, we will create an action plan addressing each specific issue.
ABMK2 Behavioral Health has been experiencing issues of low productivity, high turnover rates, a low morale, and inexperienced management team.
For the goals created for ABMK2 to accomplish, it was stated that the goals to be created must be observable and measurable to be able to note the progress. The time period agreed upon for either completion or progression towards goals was 6 months. Some of the goals that were identified by Angela Decker and her managerial supervisors were that they would like to see a documentation completed and submitted within 72 hours, because this is something that is not happening at their organization currently. They would also like employees to attend 2 team meetings per week, as team meetings are held on a daily basis, and feel that informing all of their employees would better suit the productivity of their organization. They would like 85% of the new employees to be retained beyond the trial period. This would have more of a team environment to have employees stay long term, and it would increase productivity by not having to keep continuously retraining new employees. For morale survey results, they would like to continuously distribute those on a monthly basis and see continual improvement at any rate. And lastly, for further team building efforts, to take things to a more casual effort, less formal, more informal, they would like to host monthly community building potlucks to have more of a team environment and community within their organization.
As discussed previously, data gathered from ABMK2 Behavioral Health identified 3 areas that are in need of improvement. The first, leadership and management. The second, teamwork and collaboration. And the third, morale. To address inexperienced management, Counseling Consultants, Inc. will send Dr. Angela Decker and the primary clinical supervisors, Talia, Katerina, and Josephine, to a management development training to learn total quality management, or TQM. According to an article titled Best Practices of Total Quality Management Implementation, TQM focuses on customer satisfaction, continuous improvement, teamwork, process management, systemization, organization culture and structure, and lastly, commitment for management and supportive leadership. Evidence collected through several studies has shown implementation of the total management quality modality leads to significantly superior outcomes, including improved quality and performance, employee satisfaction, better quality of service, and greater customer satisfaction. Once management has been trained on the TQM system, they will bring the system back to ABMK2 Behavioral Health and incorporate all employees into the new operating system. The second area, teamwork and collaboration, is in need of improvement. A team mindset within AMBK2 Behavioral Health is non-existent. A healthy collaborative team environment promotes productivity and quicker resolutions of conflicts or issues. To address teamwork, Counseling Consultants, Inc. recommends implementing team development interventions, or TDIs. TDIs are defined as a systemic activity aimed at improving requisite team competencies, processes, and overall effectiveness. TDIs are situationally specific. Therefore, resources for finding and implementing TDIs will be given to management. Along with this, it is suggested that the team meetings be held twice a week. And additionally, to further the building of community, AMBK2 Behavioral Health will host a potluck for all employees once a month. Data collected has also shown that there's low morale, and this is affecting the turnover rate of AMBK2 Behavioral Health. While the previous two interventions address morale to some degree, the turnover rate is high enough that Counseling Consultants, Inc. suggests a third intervention to specifically address office morale. Research has demonstrated a link between leadership behaviors and styles and employee psychological outcomes. Therefore, Counseling Consultants, Inc. suggests that leadership development intervention, LDI, should be used at AMBK2, Behavioral Health. When leadership development intervention is used as an organizational intervention, results show significant improvement of employees' attitudes towards work and work performance. Implementation of the LDI among the clients working for AMBK2 Behavioral Health should further improve employee morale as well as productivity and teamwork.
Evaluation of consultation success. The consultants will provide a goal progress survey to all members of AMBK2 Behavioral Health as a method of self-evaluation. The consultants will provide surveys at the beginning of the consultation, after 90 days of implementation of the plan, and 6 months after the plan has been implemented. Self-report results are expected to increase at each survey date. Consultants will evaluate consultees' success based upon goal completion or progress achieved toward desired goals. Areas to consider for evaluation are rate of documentation completion, employee meeting attendance rate, new employee retention rate, as well as morale survey results. Lastly, a satisfaction survey will be distributed to the consultees and their employees to report on their experience and satisfaction with the consultant intervention to assist Counseling Consultants, Inc. in the future endeavors.
After careful assessment and analysis of data provided by AMBK2 Behavioral Health, the designated consultant, Counseling Consultants Incorporated, concluded that the administration was lacking sufficient leader skills that have been impacting the organization's functionality. A meeting was conducted and the organization's CEO was present to provide support upon the recommendations by the given consultant. Being a government-funded agency, the consultant was able to assist the consultees with gaining resources to develop skills that would improve leadership through the assistance of the American Management Association. The American Management Association is a federally funded government program, and within this organization, the leaders will be able to increase their skills to increase productivity, gain managerial skills, and will learn skills for supervisory roles. And with that, this will increase productivity among their clientele and will assist them with leading this organization into the future. The consultant recommended that the courses be taken as well as to increase the knowledge, to increase communication as well among clients, employees, and the leaders. Dr. Andrew Decker was able to discuss the barriers within ABMK2 and who will also discuss that with the CEO of the health systems, and within the next 6 months the training costs will be funded to increase these skills. In 6 months, Counseling Consultants Incorporated will be able to follow up with Dr. Decker and her colleagues after completion of the courses to offer further assistance if needed.
Please use the discussion board on Blackboard to answer the following interactive questions. Question 1. What instrument was used for assessment purposes? Question 2. What is the agreed upon time for goal completion? Question 3. Identify 2 goals stated in the video. 4. Goals should be blank and blank. And number 5, name one of the interventions used. As a bonus, we would like to offer the opportunity for our classmates to come to class at our next meeting with the answer to, what does ABMK2 stand for? If you can arrive to class with this answer, there will be a reward. Please do not answer this question in the Blackboard posting. Thank you for listening to our presentation. Hope you guys enjoyed it.